Then Treya asked what you should do if you push through pain and fatigue and now the pain is constant. She said she's been to doctors but they haven't helped her. She wants to know what is the best thing to do. So this is why I tell people not to ignore fatigue. Fatigue is one of the subtle warning signs of repetitive strain injury, and what it's telling you is that you need to stop what you're doing or you will become injured. If you keep pushing and pushing, it's a setup for an injury. And soft tissue injuries, such as repetitive strain injury, are different from other kinds of injuries because when you injure yourself, the tissue that comes back to repair is not as strong as the initial healthy tissue. And so it sets up this cycle of injury, re-injury, because now you don't have the endurance that you had before. So you can't work as long as you did before because your tissues simply aren't strong enough to do that. So you need to really be careful about how you approach coming back to work if you come back to work. In the initial stages, the symptoms will be very subtle, such as fatigue. Pain comes later. And very often when people have pain, it resolves when they get a good night's sleep. So they think they're okay. And then the pain comes back and maybe it takes the whole weekend off work or the repetitive activity for them to resolve and they feel okay. And they go back and forth until the episodes start getting closer and closer and closer, and then the pain stops going away. And when people take time off work and they come back and they're feeling better, they are often astonished at how quickly their symptoms come back almost immediately after they start doing the repetitive activity that got them into trouble in the first place. So you said that your doctor didn't help you very much. There could be many reasons for this happening. Many doctors do not really understand the complexity of the upper extremity, the arm, the shoulder, the neck, the way these things work together at the workplace or during the repetitive activity. So that could be part of the reason. They just simply don't know that much about RSI. And then there are doctors who don't want to take workers' compensation cases because they are very time consuming and maybe they don't give the doctors enough time to really visit with the patients to learn their history and to give them good guidance. There are also doctors who would prefer not to deal with people who have chronic pain. But even in the best case scenario where you get a really great doctor who really understands repetitive strain injury and can help guide you through the process and write you notes so that you get accommodations from your employer, even then, most of your recovery will depend on you. Of course, you will have a team. You'll have your physical therapist and maybe complementary people who do acupuncture or osteopathy or Feldenkrais or any number of other things that make you feel better. But the people that you choose need to help you progress. You might feel really great while you're getting a massage, but then all your symptoms come back the minute you go back to the computer or the repetitive activity that you were doing that got you into trouble. So you're looking for treatments that not only help you with the symptoms, calming down the pain and the discomfort, but also helping you get better so that you can work and have a productive life and get some of your normal hand function back. So the other aspects of recovery that are up to you will be maintaining good posture, maintaining your physical fitness program. Your doctor can't exercise for you. He can't maintain proper posture for you. He can't take breaks for you. These are all things that are necessary for coping with repetitive strain injury, and you need to do them on a daily basis. You also need to practice good technique and make sure that you take regular breaks whenever you need them. And that could mean taking the rest of the afternoon off. If you're feeling symptomatic, you don't want to just keep pushing through the pain. And then I'll say a word about ergonomics. Most doctors do not have any idea what constitutes good ergonomics. And the thing that you see constantly on the internet, that square seated position, is really a recipe for disaster. That will give you an injury if you don't already have one. So I don't recommend that you follow those guidelines. If you want good information, I have a playlist on my channel that covers ergonomics that you can look at. And while ergonomics can be somewhat helpful in getting you out of awkward positioning, it won't cure repetitive strain injury, and it certainly doesn't account for the idea of overuse or cumulative trauma injuries. This happens over time. So the injury is now within you, and external gadgets such as new keyboards or mice or chairs are not going to resolve your repetitive strain injury. Although they might be able to help you continue to work, but don't rely on ergonomics alone because it won't cure RSI. You need to do all these other things in addition to that: proper posture, proper pacing, regular breaks. It's a good solid exercise program that doesn't exacerbate your symptoms. So getting back to your original question, what should I do? The very best thing you can do is stop the offending activity. Now, for many people, this means that they need to take time off work because they got injured at work. And that can be a real problem because then you wonder how you're going to make a living if you can't work at your job. So you might be able to talk to your employer about getting accommodations such as voice-activated computer programs or ergonomic equipment, and these things might help you. Also, an understanding that you need to take regular breaks so that you can keep the job that you have. But unfortunately, a lot of people either leave their jobs or get fired from their jobs because they can no longer keep up. So then the question becomes, what job can I do when I can't use my hands normally? And I do have a video about that. I'll tell you, it's not easy, but a lot of people find a way to keep working, and I really encourage you to think about your options, because the most important thing that you can possibly do is protect your hands. I know that it's very scary to think about losing your job, but if you have to choose between your hands and your job, choose your hands. That's the best advice that I can give you. And here, the good news is you can be your own best friend. You can make the decisions to find work that doesn't flare your repetitive strain injury. You can do your exercises, you can maintain good posture, you can pace yourself when you're working. All of these things are up to you. And also, even though it might be really difficult, and I understand this, maintaining a positive attitude is really helpful too. And I know it's hard. When it comes to doctors not being able to help you, I would look very hard to find a great physical therapist, because very often they are quite familiar with repetitive strain injury. They might know some great techniques in terms of manual therapy that will be helpful for you, and they can also prescribe some great exercises if they know what they're doing. So try to find a good physical therapist. Now, this can get complicated because if you're on the workers' compensation system, very often it can take weeks, if not months, to get into physical therapy. Meanwhile, you're getting worse. So that's really tricky. And also, once you get physical therapy, they may only give you 5 or 6 sessions. And that's really not enough for most people who have repetitive strain injury. You may need months, if not years, of physical therapy, because if you want to continue working, you need to have regular physical therapy to maintain that functionality. This is why it's so important that there be a national push to educate people about the subtle warning signs and risk factors for repetitive strain injury. Because if you don't know about an injury, if you've never heard about an injury until you're diagnosed with it in the doctor's office, how can you prevent it? Those are the best answers that I can give you. So I hope you do really well in your search for finding the right doctors, for getting yourself into the best physical therapy that you can, learning your good exercise program, and doing all the things that you can to help yourself come back to a maintenance level where you can continue to work without worsening your injury. So I hope this video helped you, and be sure to watch the video that's coming up next.